Hello, my name is Rasha and I am the nurse practitioner student and I am going to do the physical examination for you today. Is it okay? Perfect. So let me first wash my hands. Okay, and I am going to start asking you, tell me what's your name
Hani Anis,
and what is your date of birth
October 6, 1968,
and uh, what is the year
2018,
and what is the month?
September,
All right, and where we are
in doctor's office,
and what is our current president?
President Trump,
Okay, and what bring you here today?
for my yearly checkup.
All right, that's great. So as you see, I am assisting my patients regarding his general appearance and orientation. He is Caucasian, white male, alert, awake, oriented, times 3. He is in no acute pain or no acute distress. First of all, I'm gonna start inspecting your face and your head. And by inspection of the face, I don't see any masses or any lesions. The skin color is matching his racial heritage. The face is symmetrical. And I'm gonna check also and start palpating the face. I don't feel any masses or any skin lesions or bone lesions. Also, I'm gonna check the scalp. I'm gonna start from front to back and checking also between the hair. And I don't appreciate any abnormality or any swelling or masses or any change in the color of the skin. Second, I'm gonna check check your maxillary, your sinuses, if there is any pain or infection. So I'm gonna palpate your sinuses, the frontal sinuses. Do you have any pain here, sir, when I do the?
No,
Any pain here?
no,
So I checked the frontal sinuses and the maxillary sinuses, and I don't appreciate any pain or tenderness. Pain or tenderness on the sinuses means infection is going on and already the patient denied any pain. Now I am going to check the motor functions of the facial nerve, which is cranial nerve number 7. So I am going to ask my patient, can you please smile and show me your teeth? Great. And I want you to blow your mouth. Okay, and I want you also like to lift your eyebrows and frown. Okay, and now I assessed the functions of the cranial nerve, facial nerve, and as you see, I don't appreciate any asymmetry. Both sides of the face are symmetrical, and the muscle strengths are equal on both sides. And I don't appreciate any abnormality in the motor functions of cranial nerve 7. Okay, so now I am going to check your eyes. So I'm gonna start inspecting the eyes. First of all, both eyes are symmetrical on both level. I'm checking the eyebrows on both sides, the eyelashes on both eyes, and the eyelids. I don't appreciate any abnormality in the eyelashes or the eyebrows and the eyelids. No evidence of ptosis on both sides. And I am going now to check the conjunctiva. Conjunctiva, I don't appreciate any abnormal blood vessels in the conjunctiva. The color of the sclera is white on both sides. No evidence of jaundice. And I am checking now the iris and the cornea. And I am going now to assess the pupil on both sides. So pupil on both sides are equal and It is almost like 3 milli on both sides, round and equal, and reactive to light. When I shine the light on both eyes, the pupils are is constricted on each side. And I am going to check the accommodation too. Can you follow the pen, please? And it is also reactive to accommodation. So pupil on both sides are equal, round, reactive to light and accommodation. I already checked both eyes. Now I am going to start to examine the ears on both sides. By inspection, I see the ears are equal and symmetrical and on both level. I don't appreciate any abnormality in the skin of both ears and the external ear on both sides. No abnormal lesions or masses or drainage. I'm checking the external ear. No foreign bodies. Do you have any pain when I touch your ear?
No.
Okay. Pain when checking or touching the pen may indicate infections or otitis externa. So I am going now to start examining the ear by the otoscope. And to examine the ear for the adult, we have to straighten the ear canal by pushing the ear up and to the back, and this is to visualize the tympanic membrane. So pushing up and back, and external ear, I don't appreciate any abnormality. Now I can see the tympanic membrane. I don't appreciate any ear waxes. Tympanic membrane is round, no evidence of bulging. The color is purely gray, and I can see the malus and the ambu in the middle, and I can see the light reflects or the cone of light on the level of 4 p.m. and no evidence of any foreign bodies. I'm gonna do the same thing on the other ear, left ear, pushing the ear up and to the back, and I don't appreciate any waxes, any ear waxes. I can see the tympanic membrane, no evidence of bulging, no holes, no redness. The color of the tympanic membrane is purely gray, and I can see the malus and the ambu in the middle, and the light reflects or the cone of light at the level of 7 p.m. So both ear examination, the ears are normal. All right. So now I am going to check your nose. Inspecting the nostril, I see both nostrils are equal and symmetrical. Now let me check from inside. Nasal mucosa is pink, no evidence of change in color, and nostrils are equal on both sides, no evidence of dryness, no abnormal drainage. All right, I am going to check now the patency of the ear. So please, I want you to close one of your nostril and inhale from the other one. Okay, perfect. And the other side. I just checked the patency of the both nostrils, and both nostrils are both patent and no evidence of obstruction. Okay, I am going to start to check the mouth. So inspecting the lips, both lips, the upper lip and the lower lip, the color is pink, no evidence of pallor. Can you open your mouth, please? Okay, and I am inspecting the mucous membrane, the gums, the gingiva, the teeth on both sides, and the upper side and the lower side. I'm checking also like the soft palate and the hard palate, and the back of the mouth, the tongue, no evidence of masses or lesions. Okay, I am going to check the tonsils now. Can you please open your mouth? So I don't appreciate any enlargement of the tonsils, no redness, no swelling, and no exudate. Now I am going to check the motor functions, the hypoglossal nerve function. So please, sir, I want you to stick your tongue out. Okay, and the tongue thrust in the midline. And I want you to push against. Okay, perfect. I'm going to push against. Okay, and this is the function of the hypoglossal nerve. Open your mouth, please. I'm going to check now the functions of the glossopharyngeal and vagus nerve, which is nerve number 9 and 10, by asking the patient to say ah and observing the uvula. Okay, can you say ah?
Ah.
Okay, I just noticed the uvula rise in the middle, no evidence of deviation to either side, and this means that intact functions of the hypoglossal, thank you sir, intact functions of the glossopharyngeal and vagus nerve. Nerve number 9 and nerve number 10. Alright. Now I am going to check the neck. Inspecting the neck. I don't appreciate any abnormality in the skin color. The skin color matching his racial heritage. I don't appreciate any swelling or masses or any abnormal pulsation. Okay. Now I am going to check the carotid artery and palpate the carotid artery, and we have to make sure to palpate the carotid artery one side on the time. I can feel the carotid artery very well. It's +2 in strength. I'm checking the other side now. I can feel it very well, and it is +2 in strength. Also, I can check if there is any Broe by auscultating the carotid artery, and usually we appreciate that by the bell. I don't appreciate or I don't hear any Broe. I am going now to check for enlargement of the thyroid. The thyroid gland is usually in the middle, and normally it moves with swallowing. So I am observing and inspecting now. Can you swallow, sir? Okay, I see the thyroid move up and down with swallowing. I'm going now to palpate both lobes of the thyroid gland. I don't appreciate any enlargement or any nodularity in the surface. I am going to do the same thing while I'm standing in the back. Can you swallow, please? No nodularity and no enlargement. Okay. I'm going to check if there is any enlargement of the lymph nodes. And I am going to start first with the occipital, which usually appreciated. It's in the base of the occiput. So, okay, relax your head. Okay. This is the occipital. I am checking now. I don't feel any enlargement. Now I am going to the post-auricular, which is in the mastoid, on the mastoid bone. This is the post-auricular. Pre-auricular in the front of the ear. There's no enlargement. Now I am going down in below the angle of the mandible, which is the tonsil or the palatine tonsils. I don't feel any enlargement. Submandibular, underneath the mandible, on both sides, no enlargement. And this is the submental lymph node. I don't feel any enlargement. And the anterior cervical, anterior to the sternocleidomastoid, and the posterior cervical, posterior to the sternocleidomastoid. I don't appreciate any enlargement. And the last thing is the supraclavicular nodes, which is behind the clavicles. I don't appreciate any enlargement on both sides for all cervical lymph nodes. I am going to start checking the thorax, the heart, and the extremities. So, Mr. Anis, I want you to take off your t-shirt. Okay, first I'm going to check the thorax or the chest. First of all, I'm inspecting the breathing, and I see the patient is breathing easy, no evidence of labored breathing. Now I am going to inspect the skin of the thorax on the anterior chest wall and the posterior chest wall. And I don't see any abnormality in the skin, no skin masses or lesions or any swelling. The skin color is matching his racial heritage. And now I am going to palpate. So I am palpating the temperature, and I use the back of my hand or the dorsum of my hand. I don't appreciate any increase in temperature or hotness. I am doing now the skin turgor. The skin turgor is within normal. I don't see any evidence of tinting, and it came back in less than 2 seconds. Now I am going to auscultate the chest. So I want you, sir, to inhale in and out, in and out. Going to start up here. Again. Mhm. 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 Great. I'm gonna do the same thing on the back, and I'm gonna try to avoid the scapula. Inhale, in and out. Mhm. Mhm. Can you catch? Mhm. 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 Okay, and we don't forget to check the middle loops, and usually we appreciate it in the axillary area. Can you inhale? Mm-hmm. And on the other side. Mm-hmm. Great. Okay. The chest examinations doesn't show any abnormality. I am going to start to check the heart area, the heart examination. So it starts also by inspection. I don't appreciate any abnormality in the skin. I am inspecting if there is any abnormal heave or lift, and I am going now to palpate the apical pulse. And the apical pulse, usually we appreciate it in the fifth intercostal space in the mid-clavicular line, and I don't appreciate any heave or any lift or any swell. Okay, I am going now to go with the auscultation. Apical area again is in the fifth intercostal space in the mid-clavicular line on the left side, and usually I have to check the apical pulse in full 60 seconds, and I see it's by counting the pulse 72 per minute, and it is regular. All right, now I am going to listen to the other heart areas. This is the aortic area in the second right intercostal space. Second, left intercostal space, which is the pulmonary area. Third, left intercostal space is the herbs area. And fourth, left intercostal space is the tricuspid area. And fifth, left intercostal space mid-clavicular line is the mitral area. And I have to do the same sequences and by checking with the bell. Second, right is the aortic. Second, left is the pulmonary. Second, third left is herbs. And fourth, left intercostal space is the tricuspid. And fifth, left intercostal space mid-clavicular line is the mitral area. Okay, I just did the checking for the heart. Now I want you to lay down, sir. I am going to check the abdomen, and first of all I'm gonna start by inspection. And by inspections I see the abdomen is symmetrical and round, and I don't appreciate any masses or any lesions or any protrusions or no hernia appreciated, no evidence of scar on the abdomen. And after the inspections, I'm gonna go ahead and do the auscultation. So auscultating for the bowel sound, and usually we start like the abdomen, we make it like a 4-quadrant. And we start with the right lower quadrant, right upper quadrant, and left upper quadrant, and left lower quadrant. I am going now to do the palpation in the same sequences. For palpations, all quadrants, right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, and I don't appreciate any abnormality, and I can hear the bowel sound. It is normoactive. Also, I can check for the epigastric bruit by the auscultations, if there's any bruit on the aortic, on the epigastric area, and we appreciate that by the bell. I don't appreciate any bruit in the epigastric area. I'm going now to start checking the upper extremities, and first of all by inspecting both arms. Both arms are equal, symmetrical. I don't appreciate any abnormalities in joints, no deformity on both sides, no skin lesions or masses. I don't, the skin color matching his racial heritage. I am going now to check the temperature for the skin on both sides. By the dorsum of my hand, I don't appreciate any hotness or any increase in temperature. And now I am going to check the capillary refill on both sides. Capillary refill on both sides is within normal, and it is less than 2 seconds. I am going now to check and palpate for radial artery on both sides. I can feel the radial artery on both sides very well. It is regular on both sides and +2 in strength on both sides. Okay. I'm going to check the lower extremities, and I am going to do the same sequences. I'm inspecting the lower extremities. I don't appreciate any masses or any lesions, and the joint are okay, no deformity, no masses in the joints, the skin color matching his racial heritage, and I don't appreciate any pretibial edema by palpation here on the leg. No edema. Also, I'm going to check the capillary refill on both sides. Capillary refill on both sides are normal and are equal, and it is less than 2 seconds. I don't appreciate any evidence of clopping. Also, I am going to check the pulses on both sides. So the posterior tibial, I'm going to check on both sides to compare. I can feel both of them. It is +2 in strength. And the dorsalis pedis on both sides, it is +2 in strength. And no evidence of fingers in the upper extremities. No evidence of clopping in the nails on the upper extremities and the lower extremities. No clopping. All right, great. Can you sit up, Mr. Anis? All right. Thank you so much. Everything from your examination looks normal, and we'll see you again next year for the yearly checkup. Thank you.